with the Rocket Right Show. I'm Dr. Kay Seller in the house with Hurricane Betsy Barnes. And if you hadn't already figured it out because you're just tuning in, it's my birthday.
It's your birthday. It's your birthday.
It's my birthday. And we're so glad we had such an interesting conversation with Dr. Sanjay Lauren Juneja, and I didn't even forget how to pronounce that.
I know, you
right?
did so good.
So
they're unforgettable. They're unforgettable.
It was such a great conversation, and January was Cervical Cancer Awareness Month, which is something that, being an OBGYN for almost 30 years is something that I'm, very passionate about talking about. And then February is Cancer Prevention Awareness Month in general. So we had a great chat, but we really didn't get to the screening protocols for cervical cancer. So just for folks that didn't get to hear last week, you can actually go to our YouTube channel, and if you search under the medical segments, you can pull that up so that you get the first half of this conversation. But as far as cervical cancer, in case anyone's wondering, well, what is that? The cervix is the lower part of the womb. It is the part that dilates when a woman has a baby, and it's also what gets a pap smear done on it when a woman comes to the office. And so we're going to talk about pap smear screening. And, it's changed over the years. And it was so easy when I first went into practice in the dark ages, because all we said was, when you're sexually active and every year after that. And then now it's become so confusing, which I do think that the new guidelines have really confused a lot of women.
Right.
And what I have to keep telling them, before I retired was like, I'm more than a pap smear.
Right. Exactly. That's true.
They get that information about the new pap smear screening guidelines, and they forget that there's so much other that goes on at their gynecologic visit for other cancer prevention screenings and detection. And so I don't you feel like it has made women confused as far as when they need to see their gynecologist?
They think like every 5 years now I just need to see them, because in certain situations you can do the HPV testing every 5 years, but you need to be seeing your gynecologist more often than that.
Absolutely, and I think they get that picture, and when they hear that, they also think their insurance isn't going to cover their visit.
But they don't call the insurance company to ask.
No, they just go, I don't need that for 5 years, I don't need to see you, which is not true, because we have so many other cancers that can be detected, breast cancers that the gynecologist frequently picks up, and those mammograms are probably at an annual time. If they're not coming in, they're not getting it scheduled. And same thing as far as like just detecting masses for ovarian cancer.
Exactly. Talking about bleeding with uterine cancer, especially postmenopausal women.
Absolutely.
If you have abnormal bleeding.
So we're going to go over what the current guidelines are, and it is kind of confusing for cervical cancer screening. But remember, that's only talking about the pap smear. That's not the whole ball of wax.
Right.
So
exactly.
Which one of y'all want to hit that?
Sure, yeah. So
that confusing topic.
Right. So like you said, it used to be that we'd say once you become sexually active, but now we say you can't actually wait until you're 21. So for your first pap smear. And then from 21 through 29, it's every 3 years for a pap smear. From 29 until you're 65, it depends on the type of testing that's done. So if you have a regular pap smear, which means, like you talked about, you're going in and you're sampling the cells on the cervix, that's every 3 years. But if they're doing HPV testing, you can actually do that every 5 years.
And so the best thing to do is talk to your doctor about that, because it is so confusing, and just from being in practice, I mean, I just hate that not till you're 21, because I can't tell you, I did pick up some severe precancerous cells in girls who were under 21, and so just being
at least
old
watching
person
them,
who'd been practicing for a while, it made me a little bit nervous with some of those. So I think the best thing is certainly chatting with your physician to see what's right for you and making that decision.
And then, like we talked last time, even at 65, if you've had abnormal paps, that doesn't necessarily mean that at 65 you have to keep seeing the gynecologist. 65 is kind of the cutoff if you've had no abnormal paps for several years.
Right.
Yeah,
And
stop
then,
seeing, yeah.
right, and then you still, I would discuss that with your doctor.
And you still need to see that physician
Exactly.
because
Right.
all
Right.
cancers increase as you get older.
Yeah,
They just
especially
do.
breast cancer and uterine cancer.
Yes, and a lot
Right.
of women think, oh, I'm out of that danger, right? Because I get older. No, they all increase as you get older. So if you're not seeing your physician, then you're not going to pick up that ovarian mass, even if y'all opt to not do a pap smear.
Right.
Right.
You know.
And I think that's a really important concept is the reason it happens when you get older is the longer you live, the longer turnover and new cells you have, right? And everyone says like, oh, I have a new hand in 5 years. What does that mean? It means that technically all the other cells, like they weren't around 5 or 7 years ago. So every time you replicate, that's where you get mutations that can have error, and then eventually they stop listening to the body and grow. So if you can catch something ideally really early, so if one cell just decides to get a mutation and it somehow, eluded your immune system,
Right.
if you could ideally take out that little population, that little colony that went rogue, that's the best case scenario. It hasn't spread, it hasn't gone to the lymph nodes, and you want it out. That's what screening is designed for.
Absolutely. Getting those early changes,
Right.
pre-cancerous cells before they turn into cancer, and then the treatment is way more difficult.
Right.
Right, way more difficult. And I mean, technically, when somebody says, when will we ever have a cure for cancer? You could technically, for the most part, cure almost every cancer tomorrow if you caught it early enough.
Right.
That's
Yes.
the key. It's just get it out of the body. And that's why, a lot of people get nervous about getting screening. I'm like, I really don't want to, find out I have an incurable disease and have a, hard time with chemo. But that is not what screening is. Screening is saying, overall, if you're nervous, you're probably gonna not be positive on the scan, right? It's not like over 50% of people get cancer and everything. But what you are doing is when you're due for that mammogram and when you're due for that colonoscopy, if God forbid, if you had something, you just snip it off. On a colon, they take out colon cancers all the time
Yes.
before it gets anywhere. No chemo, no nothing.
100%.
Versus letting it ride and
I
potentially go somewhere.
love what you're saying because I can't tell you the number of women that say, well, I just don't want to know.
Right.
Right.
Oh, yes, you do.
Yes.
That would be my response. Yes, you do.
Right,
You
yeah.
want to know, and you want to know early, just like you said, when it's tiny, when you can
Tiny,
snip it
small.
out, you can get rid of it, and it's not where you have fewer options.
Right.
Exactly.
Instead, you take it out. And I would get nervous before screening myself, but I at least
course.
can remember the statistics and say, like, okay, it's very unlikely, but man, if God forbid I have something going on, I'm going to be able to find it way sooner and avoid a whole different pathway,
Exactly.
And that's
Yes.
and that's what the screening's for.
Right.
Absolutely.
And I was just going to say, like we just said, the longer you live, the higher chance. But I do want to add, because I think it's really important, because a lot of people don't know that we're seeing younger people with colon cancer.
Yes.
And because we're talking about cancer prevention, colon cancer screening now can begin as early as 45.
Absolutely. A lot of people have in their brains, 50, but that's not the case
Right.
because of it occurring earlier. And it was like twisting some woman's arm, like even at 50 to like start talking about. But look, that is like one day's test, give you peace of mind.
Exactly.
And then you're good for 10 years.
Yeah, if it's normal, 10 years.
How great.
Right.
That's one of the few screening tests. that
Right.
if you're good, you don't have
You're
to
good.
think about it
Right.
for a while.
And same with like lung. It's one of the reasons lung cancer is so deadly is because we catch it literally too late, right? So you don't get symptoms unless it's in a place where you have a cough, you're coughing up blood, but for the most part, it's just a bunch of space of air. And the saddest thing is a lot of people know about mammograms, colonoscopies. Did you know that 1 in 5 people will be saved, 20% improvement in survival, if they get a lung screen for their potential lung cancer? Now, it only applies for smoking. Only 5% of people actually get it ordered, even though it's appropriate. Imagine if 95% of women didn't get colonoscopies or mammograms.
Right.
If
I
you
know.
smoke, if you have a 20-pack year history, so 10 years of 2 packs a day, 20 years of 1 pack a day, and even if you quit, if it was within 15 years and you meet that criteria and you're over 50, you qualify for a CT lung screen low dose every year, because the only way and the best way to cure cancer is super early. And we can really help that, but 5%. It's one of the most abysmal CT screening.
And
Well,
Louisiana
yeah.
is on the bottom list of
Yes.
that.
Yeah, and we're at
and-
the bottom nationally.
Yes,
Yeah.
and I know we got a lot of smokers around here.
Yeah.
I know.
So we got to come back and talk about that. And one of the things I'd love to have y'all come back and talk to, because I like that, is prevention things that you
Yes.
can do even before screening.
That's
Personally,
right. Oh,
things
yes.
that you can do to lower your risk of all cancers. So will you come back in the future and
Oh,
talk
we'd
on
be
that?
honored.
That's
Definitely.
right. Well, we're gonna have some cake, and y'all stay put because we got City Pork talking about some party planning and Mardi Gras up next.